tooth decay, and getting good quality dental care. A digital education program. A detailed explanation follows. Using the Tooth Health Report. Topic A, Patient Care Plan, and the Self-Care Plan. Topic B, the Progress Chart. Topic C, the Clinician Care Plan, and Biopsychosocial Factors. Topic A, the Patient Care Plan. A guide to the Patient Care Plan. A summary of your tooth condition. Some dentists do not inform you of your tooth condition. You need to know the state of your teeth, so you can take action. The dentist checks for tooth decay by looking in your mouth and taking X-ray radiographs. This confirms the tests for tooth decay have been carried out by your dentist. If the dentist has never taken radiographs, this may be poor quality dental care. A tooth decay report, with a mouth map. The dentist labels where tooth decay is occurring in your mouth. The extent of the decay affects the dental treatment needed. So, enamel decay needs a fluoride application. Dentine decay needs a filling, a crown, or an extraction. Pulp decay needs a root canal filling, or an extraction. Less decay usually means simpler treatment. Deeper extensive decay usually means complex treatment. If a dentist informs you of tooth decay, ask them, is the decay into enamel, dentine, or the pulp? This shows your overall teeth health, and the total number of teeth with decay. The overall target is to have no teeth with decay. What biological factors are causing tooth decay in your mouth? Sugar intakes and the sugar clock cause tooth decay. The dentist labels your sugar levels so you can focus efforts in these issues. Plaque makes tooth decay worse. The dentist labels where your plaque is building up so you can focus efforts in these areas. Your oral hygiene is linked to where plaque builds up. So, you can understand the oral hygiene tools you need to remove your plaque. The plaque score shows your overall plaque control and the effectiveness of your oral hygiene. The target is a plaque score of less than 20%. Fluoride toothpaste makes the tooth enamel stronger to resist tooth decay. Fluoride toothpaste used needs a minimum 1000 parts per million dose for enamel to resist tooth decay. As children, your brothers or sisters with tooth decay increase your risk of tooth decay as well, because you have the same sugar diet at home. Poor saliva, or orthodontic braces, also increase your risk of tooth decay. The diagnosis report gives your total tooth decay score, and your tooth condition is linked to the stage of your tooth care. With your diagnosis report, you get a DMFT score. DMFT stands for D, how many teeth are decayed; M, how many teeth are missing; F, how many teeth are filled. In a healthy mouth, decayed teeth, D is 0, so no teeth are decayed. Missing teeth M, and filled teeth F, indicate past dental treatment. So, your diagnosis report shows your total tooth decay and risk factors of your sugar intake, your plaque removal, your fluoride use, and saliva, and is linked to your stage of tooth care. First stage, stabilization. Second stage, basic care. Third stage, advanced care. You start at stage 1 of tooth care, and progress to basic care and then advanced care. For example, you have huge amounts of tooth decay. And high sugar intake, and poor oral hygiene, plaque removal. So, your stage of tooth care is basic dental care. Because you need to reduce sugar intakes and improve oral hygiene to stop new tooth decay. Because if you have advanced care and do not reduce sugar intakes or improve oral hygiene, new tooth decay can appear on the treated teeth. Because successful dental care is high-quality treatment by the dentist and high-quality prevention by the patient. So, you do not need any more treatment in the future. Tooth decay is listed and mapped to show where decay is in your mouth and the tooth decay extent in enamel or dentine or pulp, and therefore your choice of treatment. The dentist labels your stage of tooth care. This is either urgent care or stabilization or basic care or advanced care. Plus each prevention item and each treatment item, and a dentist treatment quality score for each prevention item and each treatment item. Green means good quality care. Red means poor quality care. E-learning summary. E-learning 1, summary of treatment need. E-learning 2, diagnostic tests for tooth decay. E-learning 3, your tooth decay state. E-learning 4, causes of your tooth decay, which are sugar, plaque control, fluoride, and saliva. E-learning 5, diagnostic report, and so your stage of treatment, being urgent, stabilization, basic, or advanced care. E-learning 6, your tooth care plan. Topic A, your self-care plan. A guide to the self-care plan. What is the self-care plan? This self-care plan explains how you can look after your mouth to prevent new tooth decay in your mouth. How you can have sugar-free items or bunch sugar items together to reduce your sugar intakes, and how to reduce your sugar clock. Where to remove plaque in your mouth, and the tools needed to remove plaque effectively. Making sure the correct fluoride toothpaste is used to make your tooth enamel stronger. Using sugar-free gum, or sugar-free sweets, or cheese, after a sugar intake, to stimulate more saliva. Why do you need a self-care plan? Your dentist treatment just repairs your teeth. The only way to stop new tooth decay is with excellent prevention. So, you are responsible for good self-care. Effective dental care is when you and your dentist work together. Using a diet diary to measure your sugar intakes. Psychosocial factors and your self-care. For example, an unemployed, divorced man has less money to spend, is depressed, and isolated. So, drinks lots of beer, with sugar, for hours every day, with less self-care, oral hygiene, so he has more tooth decay. Dentists focus on the mouth. But your mental health, relationships, home life, social support, and finances play a huge role in your health. So, we work holistically to investigate your oral health. To encourage positive things in your life and manage negative things in your life. Biological risk factors that cause tooth decay in your mouth are high sugar intake and sugar clock, poor plaque removal, no fluoride use, low saliva production, and other factors, such as an orthodontic appliance. Psychological risk factors include poor motivation, high stress levels, negative mood, no time, no knowledge, or understanding, or skills, for oral prevention. Social risk factors include siblings with tooth decay, negative home environment, poor neighborhood, poor general education, poor health education, unhealthy personal lifestyle and interests, negative occupation, few resources, poor access and availability to a healthy lifestyle, unhealthy aspects of culture, no social support, and no community support. E-learning summary. E-learning 1, sugar intake plan and reducing your sugar clock. E-learning 2, plaque removal and oral hygiene tools needed. E-learning 3, fluoride analysis and toothpaste needed. E-learning 4, saliva stimulants needed and other factors. E-learning 5, psychosocial factors of sugar intakes. E-learning 6, psychosocial factors of oral hygiene. The progress chart. Why do you need a progress chart? The progress chart shows the changes in your teeth over months and years. 1. If your tooth decay levels are getting better or worse. 2. If your prevention actions are working or are not effective. For example, your sugar intake and brushing. A tooth decay progress chart shows if your levels of tooth decay are getting better or worse over time. A prevention progress chart shows if your prevention habits are good over time. You should find, as your prevention habits get better, your levels of tooth decay should decrease. E-learning summary. E-learning 1, the progress chart of your tooth decay levels. E-learning 2, the progress chart of your prevention effectiveness. The Clinician Care Plan. a guide to the clinician care plan. This includes a care sequence, starting from the dental examination, diagnostic tests and diagnostic report, to the prevention plan, and the treatment plan items. And the completion date is recorded for each item, so no item is missed from the care plan checklist. And a quality score, graded by the dentist, for each item of prevention. And a quality score for each item of treatment. A score of green means good care, and a score of red means poor quality care. And the disease risk that grades the patient according to the red, amber, green, RAG, NHS score. Red being caries present, amber being enamel caries, or other patient risk factors, and green being no tooth decay, and no risk factors being present. The risk factors for the patient are graded as red or green. Therefore, the patient is categorized into their stage of treatment cycle. The diagnostic report includes a mouth map of the caries and the extent of caries. The treatment options are partly based on the extent and depth of the caries. The quality of treatment grading by the clinician. This is the concept of dental treatment quality self-grading by the dentist who provides the care. So, it measures quality for every single patient, and not an ordered sample. Grading is performed at the end of each treatment item, so we get a real-time audit, and not a retrospective audit of poor quality, with the damaging time lag before detection. Green quality score means acceptable quality of care, when every part of the mouth is treated to the acceptable professional standard. Red quality score means deficient quality or poor quality because a. Treatment did not reach the basic standard because 1. Negligence, omitted item of treatment or care, or 2. Poor quality care, performance not to standard, through lack of care, lack of resources, or operator skill level, or 3. Poor quality care, performance not to standard, due to patient factors, after a genuine attempt by the dentist. B. Treatment reached the basic standard, but missed treatment in a part of the mouth that is in complete care. Treatment quality is divided into a treatment quality score for the finished product. For example, a root canal filling, which has not filled the whole root to the apex, is a poor quality product. A treatment quality score for the procedure. For example, not full depth anesthesia for an extraction. So, a poor quality procedure because it is painful. This is separate to the treatment quality for the finished product, that is, all of tooth was extracted from the socket. The treatment quality for the finished product affects the long-term success of clinical treatment. For example, an incomplete root filling. The treatment quality score for the procedure affects the patient experience and psychological state. For example, not full-depth anesthesia for a painful extraction may lead to a dental phobia. Each care item, for example sugar intakes, has a key quality indicators checklist, which is ticked when performed, and a completion date when all key indicators have been completed, so no item is missed, and a quality score graded by the dentist for each item of prevention. In the same way, each treatment item has a key quality indicators checklist and a quality score graded by the dentist. Any comments on the care provided are recorded so the patient is aware of any issues after their treatment completion. And a copy of the clinician plan is provided to the patient, and one copy is sent to the provider, for example NHS or private healthcare scheme. Any positive or negative issues flagged up can be managed as part of the clinician's personal development plan. Understanding biopsychosocial risk factors. Biological risk factors that cause tooth decay in your mouth include high sugar intake and sugar clock, poor plaque removal, no fluoride use, low saliva production, other orthodontic appliance. Psychological risk factors include poor motivation, high stress levels, negative mood, no time, no knowledge or understanding or skills for oral prevention. Social risk factors include siblings with tooth decay, negative home environment, poor neighborhood, poor general education, poor health education, unhealthy personal lifestyle and interests, negative occupation, few resources, poor access and availability to a healthy lifestyle, unhealthy aspects of culture, no social support, no community support. A guide to the progress chart and biopsychosocial factors. How to manage the biopsychosocial factors. Psychosocial factor management, in the patient care plan and self-care plan. From simple help to high-level support. Education and support, family, friends, volunteer sector, local support group, community center, local oral health promotion group. For example, regular oral health promotion in library and schools. Dental health support worker, used in Scotland. Change to home, adaptation and aids, for good oral health. E-learning summary. E-learning 1, Clinician Care Plan and Tooth Care Pathway. E-learning 2, Quality of Treatment and Completion Report. E-learning 3, Understanding Biopsychosocial Risk Factors. E-learning 4, Progress Chart and Biopsychosocial Risk Factors. E-learning 5, How to Manage Biopsychosocial Risk Factors.